Ever wondered how science has made it possible to conceive even when natural methods seem to fail? Today we explore one such method, intrauterine insemination, or IUI. IUI is a type of fertility treatment that involves placing sperm inside a woman's uterus to facilitate fertilization. The goal of IUI is to increase the number of sperm that reach the fallopian tubes and subsequently increase the chance of fertilization. This method serves as a bridge for couples who have been trying to conceive but have been unsuccessful due to conditions like low sperm count or mobility, unexplained infertility, or a hostile cervical condition. It's also a viable option for single women or same-sex couples who want to start a family. IUI is just one of the many fertility treatments available, offering hope to many who dream of holding their little one in their arms. Ready to dive into the IUI process? Let's get started. Before the magic happens, some preparation is required. Embarking on the journey of intrauterine insemination, or IUI, starts with an essential first step: consultation. This involves a meeting with fertility specialists who will guide you through the process, answering any questions and addressing any concerns you may have. It's a chance for you to understand the procedure better, and for the specialists to gain insights into your fertility health. Next on the agenda are fertility tests. This is an integral part of the preparation, as these tests help identify any potential hurdles to pregnancy. For women, these tests may include hormonal level checks, an ultrasound to examine the ovaries and uterus, and possibly a hysterosalpingogram, a test to check if the fallopian tubes are open. For men, a semen analysis is typically conducted. The aim here is to ensure that the sperm is healthy and in sufficient quantities for the IUI procedure. Once the tests are complete and the doctors have a clear picture of your fertility health, we move on to the next step: ovarian stimulation. This involves the woman taking fertility drugs to boost egg production, increasing the chances of success. These medications stimulate the ovaries to produce one or more eggs, and their development is closely monitored through ultrasounds and blood tests. But perhaps the most crucial part of the preparation for IUI is timing. In this process, timing is everything. The insemination must coincide with the woman's ovulation, the time when an egg is released from the ovaries. To ensure this, a woman may be given a trigger shot, a medication that induces ovulation, so the procedure can be scheduled at the optimal time. Remember, every step of this preparation is an essential piece of the IUI puzzle, each one bringing you closer to the possibility of pregnancy. It's a journey that requires patience and trust in the process. And though it may seem overwhelming, remember that you're not alone. Your fertility team is there to support you every step of the way. With preparations in place, we're ready for the big day. So, what exactly happens during an IUI procedure? Let's break it down. The IUI, or intrauterine insemination procedure, begins with the collection of a semen sample. This is typically done in a private room at the fertility clinic, and it's usually collected through masturbation. It's vital that this sample is collected as fresh as possible for optimal results. Once the sample is collected, it's not immediately ready for insemination. It has to go through a process known as washing. Now, this doesn't mean the semen takes a little bath. Rather, the washing process separates the healthy sperm from the rest of the semen. This is done using a centrifuge which spins the semen at high speed. The sperm, being the heavy hitters they are, sink to the bottom. The rest of the semen, which contains proteins that could potentially react negatively with the woman's body, is discarded. The result is a concentrated sample of healthy, active sperm. This concentration increases the odds of successful fertilization. But how do we get these eager little swimmers where they need to go? That's where the actual insemination process comes in. For the insemination, the woman lies on an examination table, much like during a regular gynecological exam. A speculum is used to open the vagina, giving the doctor clear access to the cervix. The washed sperm sample is then drawn into a thin catheter. This catheter is carefully inserted through the cervix and into the uterus. The sperm is then gently injected. This entire process is relatively quick, typically taking less than half an hour. It's also generally painless, although some women may experience mild cramping. The aim is to place the sperm as close to the egg as possible, bypassing any potential obstacles and giving the sperm a head start on their epic journey. And just like that, the IUI procedure is complete. But what happens after the procedure? Once the IUI procedure is done, what's next? Well, the journey isn't over just yet. Let's walk through the steps that follow the procedure. First stop, the 2-week waiting period. This is the time frame when nature takes its course, and the fertilized egg implants itself into the uterus. This period is often filled with anticipation and anxiety, but remember, patience is key here. Next, we arrive at the pregnancy test. Around 2 weeks after the IUI procedure, a pregnancy test can be taken to confirm if the procedure was successful. This will usually be a blood test conducted by your doctor, which can detect pregnancy more accurately and earlier than home pregnancy tests. Now, let's talk about potential side effects. It's important to note that every person's body responds differently to the procedure. Some people may experience mild cramping or slight bleeding, which is completely normal. However, if you notice severe pain, heavy bleeding, or fever, it's crucial to reach out to your healthcare provider immediately. So, what happens if the procedure is unsuccessful? Well, it's not the end of the road. There are many options to consider, including trying IUI again in the next cycle. It's common for couples to attempt IUI several times before achieving a successful pregnancy. Remember, it's essential to have open and honest conversations with your doctor throughout this journey. They can provide you with the best advice tailored to your specific situation and guide you through any decisions that need to be made. And let's not forget about self-care. It's just as important to take care of your emotional well-being as it is to look after your physical health. Reach out to support groups, talk to friends and family, or seek professional help if you're feeling overwhelmed. The post-procedure wait can be nerve-wracking, but it's an important part of the journey. So hang in there, take good care of yourself, and stay positive. Your journey to parenthood is a unique one, and every step, even the waiting, is a part of your story. We've discussed the IUI process, but what about its success rates and costs? Let's dive right into it. The success rates for intrauterine insemination, or IUI, can vary widely depending on several factors. Generally speaking, each IUI treatment cycle has a success rate of about 10 to 20%. However, this figure can be influenced by factors such as the woman's age, the quality of the man's sperm, and the overall health of both partners. For women under 35, the success rate can be as high as 20% per cycle. But as age increases, the success rate tends to decrease. For women over 40, the success rate drops to as low as 5% per cycle. The quality of the man's sperm also plays a significant role. The higher the sperm count and the better the sperm's mobility, the higher the chances of a successful IUI procedure. Let's not forget about the overall health of both partners. Factors such as body weight, lifestyle habits like smoking and drinking, and underlying health conditions can all affect the success rate of IUI. So, maintaining a healthy lifestyle is always a good idea, not just for the success of the IUI procedure, but for general well-being too. Now, let's talk about the costs. IUI is generally less expensive than other fertility treatments like in vitro fertilization or IVF. The cost of IUI can vary depending on your location and the specific services you require. On average, you might expect to pay between $700 and $2,500 per cycle. This cost typically includes the consultation, monitoring, sperm washing, and the IUI procedure itself. But remember, these are just averages, and the actual cost can vary. It's important to note that insurance coverage for IUI also varies widely. Some insurance companies cover the full cost, while others may only cover a portion or none at all. So it's always a good idea to check with your insurance provider before proceeding with IUI. Remember, every journey is unique and success can sometimes take time. So there we have it, a step-by-step breakdown of the IUI process. Intricate yet fascinating, isn't it? We've journeyed through the world of intrauterine insemination, more commonly known as IUI, understanding its core essence. We've explored the preparation phase, where everything from initial checkups to hormone injections play a crucial part. We've unraveled the actual procedure, which, although may sound daunting, is a swift and typically painless process. We've also delved into the post-procedure phase, where patience truly becomes a virtue, as we wait to see if the procedure has been successful. We've even touched upon the success rates and costs, providing you with a realistic expectation of the journey you're embarking on. In all of this, remember that every path to parenthood is unique, and there's no right or wrong way to start a family. Thanks for joining us on this journey through the IUI process. Remember, it's okay to ask for help when starting a family. The miracle of life is worth every step.